And now joining us from the West Coast is Madhuri Hedge. Really appreciate you joining us today. Madhuri, how are you, Dr. Hedge? Can you hear me? I think.
Yes, thank you, Stan. I'm doing good, and thanks for the invitation to be on this panel.
No, I really appreciate it. We know how busy you are, and we appreciate you taking time out to really help our audience understand a little bit more about what's going on within the digital aspects of the world's largest laboratory testing company, PerkinElmer. And again, for those of you who don't know, Dr. Hedge, she's the SVP and Chief Scientific Officer and Head of Global Lab Services at PerkinElmer, who, as most people know, is the world leader in lab testing services and products, and has been front and center more than anyone else in terms of making sure that not just the US, but the world has had what it's needed to get through the pandemic on the lab testing side. So, I think, first of all, Madhuri, if you could just explain to everybody a little bit about what you are, what you do, and who you are in the ecosystem. Let's start there.
Yeah. Thanks, Stan. So as you mentioned just now, PerkinElmer is a global company. It's represented in 155 countries. And PerkinElmer is mainly a product, a reagent, and an instrumentation company. We sit within the PerkinElmer ecosystem as PerkinElmer Genomic Global Laboratories, and we do comprehensive, esoteric, specialized testing globally. I come from academia to industry. I was at Emory University as a professor of human genetics in the Department of Human Genetics, and I used to be the executive director of Emory Genetics Laboratory. So basically, I have worn both hats, the industry and the academia hat, and I've been at PerkinElmer for about 4 years now.
Incredible. So just a storied career. For someone so young, fantastic to have that just that contribution too. And from your perspective and from everything that you're seeing with the lab testing industry, what and how are you seeing machine learning and algorithms being utilized, and a little bit of AI being utilized to help really rapidly evolve the lab testing industry?
Essentially, laboratory testing has sort of benefited from the rapid advances in technology. And it's almost like technology is ahead of us, and we are working to bring it in our labs. And healthcare digitization, as we all talk about it, is really the focus being to transform the healthcare services. And the goal being improving efficiency and bettering patient care. With respect to the labs itself, I think the focus really from our perspective and all labs in general, it has been improving diagnosis, a more convenient delivery system of the results, and also intake of samples, and advancing personalized care. And last but not the least, the way I look at it is streamlining the healthcare services to drive the operational efficiencies internally, and thereby increasing the access to these services.
Yeah, and there's no doubt about it. I think that's been well covered by the press, and it's been inspirational to see how that's come together. And then when you look at PerkinElmer as a global lab services company, and locations everywhere in the world, India, China, Malaysia, you name it, obviously all over the US, being a global company, how valuable is and how important is collaboration between the different PerkinElmer locations utilizing different digital means?
Absolutely. So, for me personally, coming from academia and academic laboratory as Emory Genetics Lab to PerkinElmer, this is the big transformation I have experienced, right? At Emory Genetics, we used to get samples from all over the world. What I have experienced at PerkinElmer, with PerkinElmer being at 155 countries and having labs in India, China, Malaysia, Sweden, and US, not only the labs collaborate with each other, but we also collaborate with other labs in these regions as well. One of the main things I have kind of learned and transformed over a period of time is the localization to tailor the services to the local needs, improving access. And I'll keep using that word access because I've really sort of zoned into this sort of aspect of healthcare digitization, is the access to all these new tools that we are bringing to the laboratory testing world, and also paying attention to the cultural aspect of each country. It is different. Testing in India is not as the same as testing in Malaysia, and it is not as same as testing in the US. So it's really being a very sort of a transformative phase, especially during the COVID pandemic era.
Yeah, and we can see that, right? I mean, we really do see that coming together, and part
Mhm.
of that equation, it really does focus on the global partnerships that someone like yourself is constantly bringing to the table for PerkinElmer to make sure that the company and certainly that line of business is evolving fast enough to keep pace with a rapidly emerging technology ecosystem and a rapidly emerging healthcare system that has to, again, respond and react to pandemic and now the waves of the pandemic that are rolling through different countries at different times and different parts of different countries at different times. And so when you look at that, how important are partnerships and what role do they play within the division that you run at PerkinElmer?
So when we talk of partnerships, I talk of both internal and external partnerships. So the internally, as PerkinElmer being a manufacturer, there's a thin line between very generic and being very specialized, and those partnerships are very important. So we are a customer to our own internal segments, and by that I mean PerkinElmer has four segments: diagnostics, applied markets, life sciences, and food. So we do give very active feedback internally to PerkinElmer as these tools are getting developed. And then externally, we act as in two ways, right? We collaborate with a whole bunch of different businesses across the world, across labs, across companies which are developing automation tools, but also be a backup to the customers PerkinElmer automation is at. And then on the top of that, provide services. So I have sort of experienced this sort of this wonderful ecosystem as being a very central to the how PerkinElmer delivers its services, and also externally in collaborating and bringing these new tools to the industry.
Okay, brilliant, absolutely brilliant. And when we will start to dive into the details here, and we start to look at some of the challenges that lab companies have faced and labs have faced during this unprecedented pandemic over the last couple of years, what kind of AI and machine learning tools have you seen actually doing good work and really coming to the rescue to meet some of these challenges, for the global lab services industry?
So I think artificial intelligence and machine learning, as we kind of just look at it in two separate buckets, because they're really not two separate buckets, but they're also not, the same. And I think there's this confusion of how labs actually use it. So we are essentially looking at AI to sort of to acquire knowledge, to simulate certain conditions and apply that knowledge to improve our delivery of services, versus we're using machine learning to sort of assimilate our knowledge to understand exactly how we can deploy these services. And I'm going to use two examples here. Internally with machine learning, what we have been able to do is create a software network. We call it ODIN, and ODIN stands for Order Data Interpretation Network, is to use all these resources which are there available globally and assimilate them within a standardized system. And with AI, we are really doing a lot of automation, point of care automation. I'm sitting at home and can I understand where a particular instrument in my lab went down or not? And we have something called PKI that really helps us do that. So we are bringing all these tools together to not only put them in our own labs, but make them available to other labs as well. And there is this thin line between, or sort of working on the edge of constant innovation and how to bring that innovation to the industry as well.
Yeah, and that's important, right? Because looking at what you're doing has never been more important. Really, I can't imagine a time that's been more focused and more critical for PerkinElmer to really step up to the plate and deliver on absolutely mission critical services for not just people in the U.S. but all over the world. And the data science is one of the cornerstones of what you're doing, right? And when you just talked about the AI and the machine learning of it, and certainly when you look at the future and the long term, prospects of how data science and these sorts of technologies will evolve to meet the needs of the lab services world and ecosystem. Where do you see it heading? How do you see it evolving over, these kinds of, now it seems like we heard Scott Gottlieb talk about this now being endemic yesterday on CNBC, and saying that we're now looking at an endemic flu, that cat's out of the bag, vaccinations didn't happen fast enough, and we got too many mutations now all over even just this country, much less the rest of the world. So we're looking now at an annualized endemic super flu. How will PerkinElmer step up to meet some of these challenges?
I think just in general, before I talk about PerkinElmer, is that all of us are trying to optimize this transformation that is happening on a day-to-day basis, and how do we bring it to the common individual who's trying to get these services in. So having said that, with PerkinElmer, the COVID assay which PerkinElmer has ranked number 1 on the FDA assessment of the sensitivity of the test. Now we have come such a long way since COVID. It's the last year, 1 year feels like a decade almost, that we understood very little of COVID. And at that time, when FDA was approving these assays, they were really based on analytical sensitivity and specificity. Today, what we know is a lot and not total aspect of the COVID clinical sensitivity and specificity, and what it really means to have an assay. So PerkinElmer as a company is constantly looking at these kind of developments in the science. The foundation really is the science, and to understand it as it evolves, and then also modify the strategy and how we bring new products to the market based on this science is very important, and we are very, very focused on that. I think we're very fortunate to have the labs within the PerkinElmer network where we can actively give feedback to improving this the quality of the kits, and driving towards understanding the clinical science now, having achieved that analytical mark. So this is really where we are using the AI and the machine learning to drive global delivery.
Which makes a ton of sense, and it is spot on in terms of what's really needed to get this done. And when you look at, we've got time for one more question, and when you look at how digital technology is transforming the strategy across the ecosystem for PerkinElmer, how has PerkinElmer modified its digital strategy, its overall corporate strategy relative to how digital is interpreted so fast in the ecosystem?
So PerkinElmer in the past 2 years or so has made big strides in just modifying the entire our outlook to how we are going to implement this digitization across the board. Having the global presence, how to effectively sort of have that global presence, bring that information and increase access. And again, I go back to this whole access aspect of it, because newborn screening is a major franchise within PerkinElmer, and newborn screening is an ecosystem. Which requires not just the testing aspect of it, but how you kind of bring that whole, surround that, use all the different components of the ecosystem for effective delivery. And that's what PerkinElmer really has focused on, is a digitization platform, both internally and externally, by, the tools I just mentioned, such as PKI, which is, on-site point of care for automation, and also clinical delivery of services itself.
Amazing. Well, again, Madhuri, thank you very much. A virtual applause from the attendees from all over the world watching right now. And please do keep safe. Have a great day.
Thank you.